This is NDTV. And you're watching NDTV 24/7.
Welcome. You're watching Living with COVID. This is a show where we answer your questions on the coronavirus, and we have a panel of expert doctors joining us on the broadcast. As always, they'll help you navigate this new normal that we're in. We have with us on the broadcast today Dr. B. Vijay Kumar. He is a senior consultant physician at the Yashoda Hospital. He's joining us from Secunderabad. We also have Dr. Arun Kalyanasundaram. He's on the American board, certified in cardiovascular disease and interventional cardiology. He's a director who specializes in digital CTO cases and an expert in angioplasties, especially in the difficult cases where, of course, the multi-west is large plaque block. So that's what his specialization is. He's also the director of cardiology at the Prompt Hospital in Chennai. Appreciate you doctors for being with us on the broadcast. I want to begin by asking you, Dr. Kumar, patients at this moment, of course, are very apprehensive of visiting hospitals and clinics for follow-up tests at this point. What would you like to tell our viewers? How are you keeping your consulting rooms safe from infections?
Good evening, viewers. Actually, at the outset, I'd like to tell you that hospitals are much safer than probably visiting a grocery store or a vegetable market. But having said that, unless there's a compelling indication for you to come to a hospital, it's better to have a telemedicine or a video consultation, which most of the hospitals are providing. You can contact your doctor, and if he feels that you should be visiting a hospital, you can come to the hospital. And as I said earlier, the hospitals are very safe. And as you enter a hospital, there are two areas that are divided. One is called as a fever clinic, where those who have fever and other things are isolated. They go into a different triage, where there are health workers with full PPE will check them and decide what they're suffering from. The other entrance, which is separate, is for other people who do not have fever or other symptoms. Even they are taken care of the entrance by checking their temperature with a gun, and also their hands are washed with a sanitizer, and then they are asked to enter. In the OPs also, clinics, we are using a room which is as big as possible with good cross ventilation, open door and open window, as big a consulting room as possible. And we're also grading the patient and spacing the patients. We are giving appointments only about 3 to 4 per hour, so that there will not be overcrowding in front of your door. And once you enter the consultant chamber, the patient is at least 6 feet away from you, and the doctor or health worker, whoever is taking care of you, is in full precautionary mode in terms of PPE and other things. And a patient is also given a mask at the entrance itself, and a hand sanitizer if it's not available with him. So in all, most of the precautions are taken so that they'll have a safe journey in the hospital.
All right, Dr. Arun, if I can bring you into the conversation, could you detail for us the precautions that are being taken at this point to make, essential surgeries safe? I think that's one of the biggest fears among a lot of people, specifically, our viewers. And if you could tell them about cardiac surgeries at these times, is it safe to conduct cardiac surgeries at this time?
So, I think this has been a great area of concern, obviously. So, COVID rightfully has taken center stage in terms of importance, but it is critical to realize that people still have bad outcomes due to, cardiac emergencies, essential surgeries being postponed, delayed presentation of life-threatening conditions like heart attacks, and, sometimes just, frankly, lack of beds for non-COVID admissions. So I think this is, over the last several months, this has kind of been a learning curve. Hospitals, on their part, have taken several steps to make sure patients are taken care of and are protected. So, firstly, of course, you have certain hospitals that are kind of earmarked for COVID patients, and then you have certain hospitals where COVID patients aren't admitted, so the so-called non-COVID hospitals. And even in hospitals where COVID patients are admitted, typically they are clearly demarcated areas where COVID patients and non-COVID patients are admitted differently. Secondly, I think there's been a lot of education, not just for doctors, but also for healthcare personnel, the ambulance staff, the person at the door, everyone on, how do you wear PPE, like how do you protect yourself, protect patients that are visiting, etc. I think this has kind of been a fairly steep learning curve for all healthcare personnel, besides just the general public. One other thing is that if it's a non-emergent surgery, many times patients are tested for COVID in order to reduce the risk of cross-contamination across patients. And remember, patients with essential surgeries will, by definition, still need to have that. And I think, this is the fear in people's mind that, okay, I can't go to the hospital, I'm going to get COVID, often trumps. And I would say it has almost become an irrational fear at times, where people are just so scared, even when they are having chest pain or a heart attack, and don't go to hospitals. So if I may, I just want to emphasize the point that healthcare organizations, doctors, and across the board, we are trying to make hospitals safer so that patients can get the care that they deserve.
All right, I think very crucial for a lot of people to hear at this moment. Dr. Kumar, if I can come back to you, what advice would you like to give patients who are suffering from diabetes in the times of this pandemic? Any, extra care or anything special that they need to do?
Yeah, as the data shows in the last 5 or 6 months, patients who have comorbidities like diabetes have a higher mortality rate. So they need to be extra cautious when they are facing the pandemic. So when they have no symptoms, or if it's not a COVID patient too, then if they are able to operate a glucometer, it's advisable for them to check probably more frequently the glucose levels and maintain a glucose level between 110 and 180. And as far as the drugs are concerned, most of the drugs that they have been using can be used if they have no symptoms or they have only mild symptoms. But in patients who have probably moderate symptoms, then probably your doctor will advise you to stop a particular group of diabetic medication called as SGLT2 inhibitor, because it has been found to have a particular role in producing more amount of acidosis and diabetic ketosis, etc. Although there's not much evidence to that, but still it is advised by WHO and other organizations to stop SGLT2 at that particular period of time. In asymptomatic people and mild people, all the regular medications that we've been using can be used. But in moderate or severe COVID patients where they are hospitalized, probably your doctor will shift you on to an insulin, a rapid active insulin, either in the form of an infusion or a basal bolus way, whichever is convenient for them. More than these drugs and other things, they are supposed to maintain a healthy lifestyle, have their regular walks in their house, or if they have a garden, they should walk around, keep themselves busy, eat a freshly cooked meal each time if possible in intervals, and check their regular sugars on and off, and maintain a good hydration. These are the pillars of maintaining a good environment and making a good diabetic control.
Right. Dr. Arun, if I can bring you back into the conversation, heart attacks are, among the biggest causes of deaths even here in India. How do you manage cardiac emergencies in times of the coronavirus? This, of course, is in context of doing thrombosis versus an angioplasty during emergency procedures.
So again, another great question. Thanks for bringing this up. First, I think we need to understand what a heart attack is. In layman's terms, heart attack is when blood flow to the heart muscle is essentially blocked, and the heart muscle essentially is actively dying. So not only in India, but if you look at it globally, heart attacks are the #1 cause of death. And the saying really is that time is muscle. So what do I mean by this? You have to work to really restore blood flow to the heart so that you can prevent cardiac damage and death. So thrombolysis is where you give a clot buster, and this is often in vogue in India due to logistic reasons and lack of 24/7 primary angioplasty centers. However, if you look at it globally, primary angioplasty or going into the cath lab and trying to open up the blockage with wires, balloons, and stents is the gold standard for managing an ST elevation MI or a heart attack. And we have been routinely treating patients 24/7. The key thing is you still have to wear your personal protective equipment or PPE. You have to assume that anybody that walks in that you have not tested and ruled out does have COVID. So, it's not fun to wear these things, but you essentially do have to wear PPE, the N95 masks, or an AF respirator. And there are lots of things that we do to ensure that these procedures are still done safely, so that we can address the problem of heart attacks. And clearly, primary angioplasty, if it can be offered in a timely fashion, is the best thing for the patient. One other point I want to mention here is that when you do give the clot buster, many times what's happening these days is because of what we talked about earlier, the fear of getting to the hospital, delayed presentation. So people have symptoms and then they're having a heart attack, but often end up very late in the game. So, the effectiveness of clot busters is even further reduced. So, clearly there is a need for us to continue to do primary angioplasties in this country despite these troubling times.
All right, on that note, we're going to slip into a very short break, where our panel of expert doctors will be live with us on the other side. Do stay tuned.
Knowledge Partner, USV, your reliable healthcare partner.
Welcome back. You're watching Living with COVID. Let me go straight across to Dr. Kumar. Dr. Kumar, symptoms like breathlessness and respiratory problems, there's a lot that is in common between COVID-19 patients as well as asthma patients in terms of symptoms. How does one differentiate between what is COVID-19 and what is just regular symptoms of asthma or respiratory issues?
The basic problem is most of the things are not so easy to differentiate, but there are definite certain pointers where you can say probably this breathlessness is because of COVID-19. Usually the breathlessness that develops in COVID-19 is probably gradual in onset, unlike that in asthma where you have a severe asthmatic attack or a cardiac failure where it's sudden in onset. And then the people who have breathing difficulties in asthma and cardiac failure, they tend to feel better once they sit up and move in front a bit. They feel slightly more comfortable. But in COVID patients, they feel much better if they lie down on their chest and stomach, which that's called as prone position, which they feel better. And one other symptom what's characteristically present in COVID-19 patients is the severe constricting type of chest discomfort or a breathing difficulty that is there, which slightly differentiates from asthma and cardiac failure. Of course, in asthma, patient can have that wheezing sound, and the rails can be heard by the patient, but in COVID, the breathlessness usually does not have any external sounds.
Right. Dr. Arun, if I can come back to you at this point, are ARC inhibitors or ARBs safe for use in managing cases of hypertension?
Absolutely. This has been another area where, we do know thus far that the ACE2 receptor is clearly implicated in the causal pathway of, the COVID, how COVID virus affects our body. However, now lots of studies have kind of looked into this issue and seen, okay, now is it safe to take it? Should we take it? Should we not take it? The long and short of it, without quoting every study that has looked into it, is that, we do know that using an ACE inhibitor or an ARB has not been associated significantly with either the COVID-19 diagnosis or with mortality amongst those patients, meaning the risk of dying amongst those patients that have been diagnosed with COVID-19. So the long and short of it is patients should continue to use their ACE inhibitors or their ARBs as advised by their doctors.
Right. Also, Dr. Arun, it's been observed that many COVID patients die due to heart attacks. This obviously makes heart patients more susceptible to complications as a result of COVID-19. What are the kind of do's and don'ts? What about the chance of contracting an infection if you're a heart patient?
So again, another great question. So a couple of things, right? So people with certain comorbid conditions, and cardiac disease is one of those. If you have a history of cancer, diabetes, asthma, heart conditions, people that are older than 60, even obesity, these people are at definitely higher risk because there are a lot of patients that are asymptomatic. So if these patients do contract the infection, there's a much higher chance that they could have more complications and thereby the chance of dying. Also, this is the group where, this is the high-risk group, the ones that might get really sick. So clearly, cardiac patients fall under this category. And interestingly, initially when COVID came about, people thought, okay, this is a respiratory illness. It's just like a cold. It's going to it's going to cause respiratory symptoms. But now we have found that this can affect almost every part of the body, and definitely it can affect the heart. It can present as what we call myocarditis, or an inflammation of the heart muscle. It can present just like a heart attack. So there are myriad forms by which COVID can manifest in patients. So it is critical. Really, if you do have comorbid conditions, number one, all the precautions that we keep hearing over and over again, in media, television, and whatnot, is like, if you do have comorbid conditions, if you have cardiac disease, don't go out unless you have to. Again, I'm talking about those non-essential trips to the market, etc. I'm not talking about if you have chest pain, going to the hospital. Let me be very clear about that. And even within the home, try and not, keep, if you do have heart disease, or, if you have one of the other comorbid conditions that we talked about, it is important to try and keep ourselves to a very limited exposure to other people, because there was again some controversy about this. Do asymptomatic people transmit or not, etc.? But clearly we do know, and I think most of the evidence would point that even patients who are either pre-symptomatic or asymptomatic, meaning no symptoms, can still transmit disease. So every person that you come across is potentially someone that could infect you. Hence the importance of, rigorous hand washing, social distancing, wearing masks when you go out, etc. So please, if you are at a higher risk, be extra careful.
All right, so if you're at a high risk, you must be extra careful. Dr. Kumar, as India enters several phases of unlock, people are now back in the offices, people are going to work. What are the kind of precautions that one must take to protect oneself, especially in a workspace?
Yeah, that's a great question. Yeah, as you said, most of the offices are very closed spaces. You do not have much adequate ventilation, and most of them have internal ACs, which most of the areas, I believe, the percentage of air that is being sucked out and the air that comes in from the external environment is very meager. It varies from 7% to 30% in different offices, which is basically a nidus for getting a pandemic like COVID into a much higher scale. So if going to an office is a must, and then they have to take utmost precautions when they're actually at home before they even enter the office. They should maintain a good lifestyle, have a regular exercises, have a good hot meals daily, and they should be prepared to enter the office with compulsorily a mask on, which does not have a valve is recommended because it will not infect others, and you should have a sanitizer with you. And if you have a facility where you can wash your hands with soap and water, that's a much better option. As much as possible, try not to touch the doors, door knobs, or whatever the rails or side rails, whichever in the office. Probably go to your office, maintain a physical distance of at least 6 feet. The other person working in your office also should have a mask on, the mask without a valve, and perfect distancing. And if you get a cough or sneeze, better cough into your elbow, and try to take as much less interventions as possible. If possible, even in the office, if the person is far off, then you can probably communicate through a video call and limit as much physical contact as possible.
All right, I think that's very crucial advice there, Dr. Arun. If I can give you the final word and sort of just put the focus back on cardiac diseases, because there's been a lot of interest around those questions. How can cardiac patients effectively manage their condition at home? What are the do's and don'ts? What are extra measures that they can take to build their immunity to guard themselves against COVID-19?
So again, this is critical. People aren't able to go out and do all the stuff that they used to before. You can't just go for a walk without worrying about, okay, am I going to get COVID or not? So it is important, I think, for the foreseeable future. Countries are racing against time to develop vaccines and this and that. But for the foreseeable future, I think we will have to learn to live with COVID rather than just wait until everything is over. But again, we have to live carefully. So, a couple of things. Number one, anytime it's possible, I think, clearly try and not be in confined spaces. If you can have good ventilation, that's always a good thing. Having natural sunlight is a good thing. So even at home, try to do these more. The next thing is, yes, even if you can't go out for a jog, you could still continue to make sure that you stay healthy at home. Eat healthy, work on stuff to boost your immunity. Make sure you get adequate exercise and sleep at night, get enough time. Because we do tend to run into this problem where a lot of people are sitting home, watching TV or whatever late into the night, and then it totally affects your sleep cycle. So make sure, especially if you're a cardiac patient, that you kind of try and stick to a decent sleep schedule, get your workouts, and most importantly, do not ignore your symptoms. I know if you do have chest pain or sudden difficulty breathing, etc., not only could this be COVID, but it could well be, a cardiac problem that's manifesting. So I would implore you not to ignore symptoms. And if you do have chest pain, the general advice still holds. Take a full dose aspirin and get to the nearest hospital, or call for an ambulance if you're in a place where you can reach a hospital soon. And I'm also going to take this opportunity to kind of address something else, which is, don't forget your regular checkups, right? COVID has forced us to re-examine traditional methods of the patient-doctor relationship. We routinely see patients via video consults and telemedicine. Virtual clinics are being set up. This situation has really kind of forced us to kind of say, hey, if you don't have to come in for just routine checks. Now, another piece of advice that I would give is that if you're really concerned is you could get a blood pressure monitor at home, maybe even a pulse oximeter, so that it adds more value to a teleconsult. And I think smart technology to monitor patients remotely are all being developed as we wait patiently for a vaccination. So, like I said, the key thing, stay safe. Continue to, get your exercise, eat healthy, work on your immunity, sleep well. Don't go out unless you have to. Do not ignore symptoms. That's basically it in a nutshell.
All right. On that note, I think that's all we have time for on this broadcast. But that's very useful advice, Doctor. Thank you so much for joining us on the broadcast and sparing the time of day.
Knowledge Partner, USV, your reliable healthcare partner.